Hello and welcome to SENDIASS Rutland. Healthcare. Would you like to know about your rights and your child's rights to healthcare? Would you like to understand more about the different types of healthcare? And would you like to know where to get more help and support? Primary, secondary and tertiary care. All families will come into contact with the NHS at some point, but if your child has a disability or health condition, then you may find you use lots of different services provided by the NHS and have more frequent contact with health professionals. There are a number of ways that disabled children and young people will come into contact with the health system. First, you will find primary care, which is classed as universal health care. Then secondary care, which is some form of specialised care. And finally, tertiary care, which is highly specialised care. Primary care. This is universal health care provided for a local community that is accessed directly. It includes professionals and services accessed through a general practice including GPs, practice nurse and some community health professionals such as community children's nurses or community dentists, podiatrists and opticians. Accident and emergency departments also provide some elements of primary care. Primary care is commissioned by NHS England, school nursing is commissioned by the local authority, and A&E services are commissioned by your local clinical commissioning group. Secondary care. This is more specialised healthcare that requires a referral from primary care to access. In most cases, your GP will be responsible for providing a referral to a secondary healthcare professional. This secondary care may be based in a community health setting or a local hospital. Some examples include community paediatricians, occupational therapists, physiotherapists, speech and language therapists, audiologists, Child, Adolescent and Mental Health Services, or CAMS. Most secondary health services will be commissioned by the local Clinical Commissioning Group, or CCG. Tertiary care. This is highly specialised healthcare services that requires a referral from primary or secondary care. Normally, this will be your GP or community paediatrician, but may include other secondary health professionals. Examples include a consultant paediatrician at a specialist hospital, specialist nursing teams, Child, Adolescent and Mental Health Services CAMS. Specialist tertiary services are commissioned by NHS England. Appointment anxiety. If your child finds it difficult to wait or is anxious about going to new places or meeting new people, then taking them to visit the doctor or hospital can be extremely stressful for yourself and your child. Here are some tips which other parents have found useful in this situation. Try and get appointment times at the start of clinics when there is likely to be less of a wait. If your child does not like to be in crowds of people, explain the problem to the receptionist and ask if there is a quieter room where you can wait. Write on a postcard what might be difficult for your child and give it to the receptionist so you do not have to say it out loud for others to hear. Ask the receptionist to let you know if there is going to be a long wait so you can take your child for a walk and come back later. Ask if you can wait in the car outside and be called on your mobile when the doctor is nearly ready to see you. If possible, try to get appointments with the same doctor or health professional on subsequent visits so they get to know your child's additional needs and you do not have to keep repeating your story. And before they examine your child, explain to the doctor what might stress your child or trigger behaviours that challenges and suggest strategies that might help. Hospital admission. If you know your child is to be admitted to hospital, telephone the hospital to let them know your child has additional needs. Ask for a pre-admission meeting with a senior nurse on the ward where your child will stay to discuss your child's additional support needs. If your child has a learning disability, ask if the hospital has a learning disability nurse and try to speak to them as well. They can be very helpful in liaising with hospital staff to make sure the stay is less stressful for your child. You can write down all the things that your child might find particularly stressful and how they are likely to respond. Take this with you. It is also helpful to take this with you if your child has to go to hospital in an emergency. Leicester Children's Hospital Patient Passport is available for free on their website. Simply print it out and fill it in before you visit the hospital with your child. Consent to treatment. Before a medical practitioner can examine or treat your child, they need consent. The way consent is asked for partly depends on what the medical practitioner plans to do. If a GP wishes to look in your child's throat, they will ask your child to open their mouth. You may then need to encourage your child to do so. This is usually enough to demonstrate that they and you have given consent. For more complex healthcare and treatment, there are some differences in the rules about consent for children, young people, and adults. Consent to treatment, adults. Once a person has reached the age of 18, no one can give consent on their behalf. If they are not competent, clinicians can provide treatment and care, providing this is in their best interests. The Mental Capacity Act in 2005 governs decisions made on behalf of adults when they do not have mental capacity. Consent to treatment, young people aged 16 and 17. Young people are presumed to have the competence to give consent to treatment for themselves. The Department of Health recommends that it is good practice to encourage young people of this age to involve their families in decisions about their care, unless it would not be in their best interest to do so. Consent to treatment, children under the age of 16. Children under 16 years of age can give consent to medical treatment, providing they have demonstrated that they have sufficient capacity to decide. This depends on their ability to understand what is involved in making the decision. There isn't a general test to assess a child's capability, and each case should be assessed based on the individual circumstances. When a child is not able to give informed consent, a person with parental responsibility can give consent for them. Patient Information and Liaison Service. The Patient Information and Liaison Service, or PILS, is a confidential service provided by NHS organisations including hospitals, mental health services, community services, and clinical commissioning groups. They can help if you don't know what's happening, want information but don't know where to get it, want to resolve a situation but don't want to complain but not sure how, and want to speak to someone but not sure who. Local authority responsibilities. The Rutland Health and Wellbeing Board has been set up to develop and deliver joint health and wellbeing strategies through partnership working. The introduction of the 2014 CARE Act gave local authorities the legal duty to offer access to independent advocacy to anyone engaged in adult social care processes. The local authority must arrange an independent advocate to facilitate the involvement of a person in their assessments, preparation and review of their care and support plans, and support through safeguarding adult inquiries and reviews under the CARE Act 2014. The SEND Code of Practice says, local authorities, CCGs and other partners must work together in local health and wellbeing boards to assess the health needs of local people, including those with SEN or who are disabled. CCGs, NHS trusts and NHS Foundation trusts must inform the appropriate local authority if they identify a child under compulsory school age as having or probably having SEN or a disability, which is Section 23 of the Children and Families Act 2014. Who is Independent Care Act advocacy for? The service is available for anyone living in the counties of Leicestershire or Rutland for adults, young people going through transitions, care leavers, carers, young carers, prisoners currently detained in the area who are subject to social care processes and are struggling to engage with or understand the process. You can call them on 0116 204 5110 or email them advocacy@agukleics.org.uk. Healthcare within school and education settings. Every child is entitled to education. Governing bodies must ensure that arrangements are in place in schools to support pupils at school with their medical needs. School leaders should consult health and social care professionals, pupils and parents to ensure that the needs of children with medical conditions are properly understood and effectively supported. Supporting pupils with medical conditions. Designated clinical officers, or DCOs, are the point of contact for local authorities, schools and colleges seeking health advice on children and young people who may have SEN or disabilities. They can support schools with their duties under the Supporting Pupils with Medical Conditions government guidance. Health professionals, for example school or specialist nurses and therapists, may work directly with your child or young person and advise or train settings to manage health conditions such as epilepsy and diabetes, or with techniques such as tube feeding in schools. School policies should include who is responsible for ensuring that sufficient staff are suitably trained, a commitment that all relevant staff will be made aware of the child's condition, cover arrangements in case of staff absence or staff turnover to ensure someone is always available, briefing for supply teachers, risk assessments for school visits, holidays and other school activities outside the normal timetable, and monitoring of individual healthcare plans. Individual healthcare plans. An IHCP is designed to keep children with medical conditions safe, well and involved at school. They are not the same as education, health and care plans, but some children may have both an EHCP and an individual healthcare plan. You and your child's school should agree how often the healthcare plan will be reviewed. It's advised that this happens at least once a year, but it may need to happen more frequently if your child's condition is unstable or their medication changes. Who needs an individual healthcare plan? There's no specific guidance on what sort of medical conditions warrant an individual healthcare plan, and it's up to schools to decide if your child needs one. If your child has a severe or complex medical problem or needs specialist care, a healthcare plan is likely to be essential, but for less complicated conditions, it may not be necessary. Schools are advised to use common sense when deciding whether a child should have a healthcare plan and should take your views into account. They must also consider each child's case individually. Children vary in how they cope with medical conditions. Some may need extra help to manage a condition that another child is able to handle by themselves. What does an individual healthcare plan include? An IHCP should be as simple and uncomplicated as possible. Schools are free to draw up their own plans, and the level of detail included will depend on each child's needs. However, a good care plan should include your child's personal details such as name, date of birth, class, and ideally a photo to help staff identify them, the name of their condition or conditions, contact details for both parents or other family members, the GP and their clinical consultant, a description of their condition and the symptoms that affect them, information about your child's daily care requirements, for instance medication, including the dose, storage requirements and side effects, dietary requirements, special facilities needed in school, such as access to a disabled toilet, and social and environmental needs, such as extra time between lessons. What sort of support your child needs with their daily care, and who at school will administer it. What constitutes a medical emergency relating to your child's condition, and what action they should take if it occurs, for example administering an EpiPen in the event of an anaphylactic reaction, and the date of preparation of the plan and the date when it should be reviewed. If your child will need to be given medication at school. You should also be asked to fill in a form giving details of their treatment and your permission for staff members to administer it, or for your child to take it themselves if they are old enough and able to do so. Model process for developing individual healthcare plans. The flowchart below is the Department for Education's guidance for supporting pupils at school with medical conditions. The parents, health professionals or school can start the process. School is informed that child has new diagnosis, to attend new school, due to return to school after long absence, or that needs have changed. Head teacher or delegated staff coordinates meeting to discuss child's medical support needs and identifies member of staff who will provide support to the pupil. Meeting to discuss and agree on need for IHCP to include key staff, child, parent, relevant healthcare professionals and clinicians, or written evidence. Develop the IHCP in partnership and agree who leads. Input from healthcare professionals must be provided. School staff training needs identified. Healthcare professional commissions or delivers training and staff signed off as competent. Review date agreed. IHCP implemented and circulated to all relevant staff. IHCP reviewed annually or when condition changes and parent or healthcare professionals initiate review. And then back to starting the meetings again. Equality and inclusion. Some children may not be able to attend school for health reasons, for long-term or intermittent periods. For children with SEND, anxiety or sensory overload are common factors affecting attendance, which are sometimes not immediately identified. If you think there may be underlying needs affecting your child's attendance, discuss and explore with school how these might be supported. Reduced timetable. A reduced timetable can be an effective temporary measure to support some children. There should be a plan to support an increase to full-time, regular reviews, and only with parental agreement and involvement of appropriate services. If you are feeling pressured to accept a reduced timetable, talk to school about whether there are other appropriate support options. For example, a Common Assessment Framework, CAF, which is a shared assessment and planning framework. Referral for alternate provision, such as the Children's Hospital School or a pupil referral unit. Referral to a health service, such as CAMS. Where support options in school have been exhausted, a request to the local authority to carry out an EHC needs assessment, and where an EHC plan is already in place, requesting an early annual review. The Department for Education guidance about attendance says, all pupils of compulsory school age are entitled to a full-time education. In very exceptional circumstances, there may be a need for a temporary part-time timetable to meet a pupil's individual needs. A part-time timetable must not be treated as a long-term solution. Any pastoral support programme or other agreement must have a time limit by which point the pupil is expected to attend full-time or be provided with alternative provision. Getting the right help in place. It's important to notify the school as soon as your child is diagnosed with a medical condition. If your child is about to start or change school, try to work with the new school in advance so the right support can be put in place from the beginning. Ask for the school's medical needs policy and ask for a meeting with the member of staff responsible for medical needs. Common questions. My child has medical needs. Can she or he have an education, health and care plan? Although EHC plans cover all three areas, including health, they are education driven. It is only possible to trigger the EHC assessment process if your child has an educational need. However, it is worth bearing in mind that the definition of special educational need has two parts and includes 1. Children who have significantly greater difficulty in learning than others of their age, or 2. children with a disability who can't access educational facilities normally available in mainstream school. Some children with medical needs may fit the disability part of the definition. Can school staff refuse to give my child medication? Giving medication is not part of school teachers' conditions of service, so an individual teacher can't be forced to give medication. Teachers can volunteer to do so if they wish. Support staff may have the requirement to give medicine written into their contract. The school should ensure that there are sufficiently trained staff available to give medication to children who cannot manage it themselves. Parents should not be asked to come into school to give medication. Can health and social care provision be written into an EHC plan? It is important to note that healthcare provision or social care provision which educates or trains a child or young person is treated as special educational provision, which you can find more on in section 21(5) of the Children and Families Act 2014. A good example of this is speech therapy. It looks like it should be health provision because it is usually provided by the health service, but it must be treated as special educational provision. This is because speech and language therapy educates or trains a child or young person to communicate more effectively. Any healthcare provision will have to be agreed by the local CCG before it can be written into an EHC plan. Once provision is written into an EHC plan, it is legally enforceable. If it is in the education or social care provision sections of the EHC plan, then the local authority must ensure it is provided. If it is in the healthcare provision section, then the CCG must provide it. What if the health and social care provision in the EHC plan is inaccurate or inadequate? During an EHC needs assessment, the local authority should seek advice and information from health and social care. If this is not done, this could lead to inaccurate or inadequate sections of the EHC plan, which are blank or say, not known to the service, or no health or social care needs, when this is not the case. National organisations. Contact a family, supporting families that have a disabled child. Council for Disabled Children, an umbrella body for the disabled children sector, bringing together professionals, practitioners and policymakers. Health for Under 5s, Health for Kids and Health for Teens. This is information and health advice for parents and carers from pregnancy through to when a child starts school and for children and young people up to the age of 25. MenCap. MenCap are here to improve the lives of people with a learning disability and their families. NHS Children and Young People Services. Information about what to do if you're concerned about your child. And Scope, the disability equality charity in England and Wales that provide practical information and emotional support to families.